Have you ever walked into a room and suddenly forgotten why you were there? Or struggled to remember a familiar name that should have come to mind instantly? If you're over 60, moments like these can be unsettling. Your first thought might be, is this just normal aging or something more serious happening? Many older adults quietly carry this worry every day. They begin questioning their memory, their confidence, and even their independence. But what if one of the most overlooked contributors to memory changes isn't aging itself? What if it's hiding in your medicine cabinet? Here's something that surprises many people. Certain medications can affect thinking, alertness, or memory in some individuals, especially as we get older. That does not mean these medicines are bad, and it certainly doesn't mean you should stop taking them on your own. In fact, many of them save lives and are essential for managing chronic health conditions. However, as our bodies age, the way we process medications changes. A dose that worked well years ago may affect you differently today. Later in this video, I'll share one simple step that many geriatric specialists recommend to help reduce the risk of medication-related memory problems, and it's something every older adult can do before their next doctor's appointment. Welcome back. If you're new here, this channel is dedicated to helping adults over 50 enjoy healthier, stronger, and more independent lives through practical, science-based information. Our goal isn't to create fear. It's to give you the knowledge you need to have better conversations with your healthcare team and make informed decisions about your health. Let's begin with an important fact. Memory changes can have many causes: poor sleep, dehydration, vitamin deficiencies, depression, hearing loss, infections, thyroid problems, uncontrolled diabetes, and certain medications can all contribute to forgetfulness or confusion. That's why it's so important not to assume that every memory problem automatically means dementia. In some cases, identifying and addressing an underlying cause may improve symptoms. One group of medications that often deserves careful review in older adults is medications with anticholinergic effects. These medicines are used to treat a variety of conditions, including allergies, overactive bladder, motion sickness, and sometimes sleep problems. While they can be effective, they may also cause drowsiness, dry mouth, blurred vision, constipation, and in some people, confusion or difficulty concentrating. Older adults are generally more sensitive to these effects because aging changes how the brain responds to certain chemicals. It's important to understand that not everyone experiences these side effects. Some people take these medications without noticeable problems, while others become much more sensitive. This is one reason why medication choices should always be individualized. Your overall health, kidney function, liver function, and the number of medications you take all influence how your body responds. Another category worth discussing is certain sleep medications and sedatives. Many people have trouble sleeping as they get older, and it's understandable to want relief after spending night after night awake. Some prescription medications can be very helpful when used appropriately, but they may also increase drowsiness, slow reaction time, affect balance, and contribute to confusion in some older adults. That's why many healthcare providers recommend using the lowest effective dose for the shortest appropriate time whenever possible, and exploring non-medication approaches to improving sleep as well. Pain medications deserve attention too. Certain opioid pain relievers are important for managing severe pain after surgery, injuries, or serious medical conditions. However, they may also cause sleepiness, slowed thinking, dizziness, or confusion, particularly when treatment first begins or when doses are increased. Again, this doesn't mean these medications should never be used. It simply highlights the importance of close medical supervision and regular reassessment to ensure the treatment remains appropriate. Let's pause for a moment because I'd really like to hear from you. Have you ever started a new medication and noticed that you felt unusually sleepy, forgetful, or mentally foggy? Or have you had a medication changed because of side effects? Share your experience in the comments. Your story may help someone else realize they're not alone and encourage them to discuss their concerns with their healthcare provider rather than simply assuming it's just getting older. Another medication group that sometimes contributes to cognitive side effects is certain medications used to treat anxiety. These medications can be effective for specific conditions, but in some older adults, they may also increase drowsiness, affect coordination, and reduce alertness. When combined with other medications that also cause sedation, these effects may become even more noticeable. That's one reason healthcare providers carefully consider the complete medication list before prescribing new treatments. As you begin paying closer attention to your medications, you may notice something encouraging. Instead of feeling anxious, you begin feeling more informed. You recognize that memory changes deserve evaluation, not panic. You understand that medications are only one possible factor among many, and you realize that working closely with your healthcare team is one of the best ways to protect both your physical health and your cognitive well-being. We're only halfway through this discussion. In the next part, we'll explore several additional medication categories that older adults should review with their healthcare provider and reveal the simple medication habit I mentioned at the beginning that experts strongly recommend, and explain practical steps you can take to help support your memory while safely managing your prescribed treatments. Let's continue by looking at several more medication categories that are worth discussing with your healthcare provider, especially if you've noticed new problems with memory, concentration, or alertness. Remember, the purpose of this conversation is not to make you afraid of medication, it's to help you become a more informed partner in your own healthcare. Many medications are life-saving and should never be stopped without medical guidance. The goal is simply to make sure every medicine you take is still the right one for you. Another group that sometimes deserves review is certain medications used to treat seizures or nerve pain. These medicines can be extremely effective and are often prescribed for conditions such as epilepsy, shingles-related nerve pain, or chronic nerve disorders. However, some people, particularly older adults, may experience side effects such as dizziness, slowed thinking, fatigue, or difficulty concentrating. These effects may improve as the body adjusts, or they may signal that a dose adjustment or a different medication should be considered. That's a decision to make together with your healthcare provider. Some medications used to treat depression can also affect individuals differently. For many people, antidepressants greatly improve quality of life by reducing depression and anxiety, both of which can themselves interfere with memory and concentration. However, certain antidepressants may cause drowsiness or other cognitive side effects in some individuals. This is one reason why healthcare providers carefully choose medications based on a person's age, medical history, and overall health, rather than using the same treatment for everyone. Medications for overactive bladder are another category worth mentioning. These medicines can help reduce urinary urgency and improve daily comfort, but some have anticholinergic properties, which may contribute to confusion or memory problems in certain older adults. So, fortunately, newer treatment options may have a different side effect profile for some people. If you've noticed changes after starting one of these medications, it's worth having an open conversation with your healthcare provider rather than simply accepting the symptoms as part of aging. Even some medications that are available without a prescription deserve attention. Certain nighttime cold remedies, allergy medications, and sleep aids contain ingredients that can cause drowsiness or affect thinking, especially in older adults. Because these products are sold over the counter, many people assume they're completely harmless, but over the counter doesn't always mean risk-free. These medications can interact with prescription drugs or produce stronger effects as we age. That's why it's a good idea to tell your healthcare provider and pharmacist about every medication you take, including vitamins, herbal supplements, and non-prescription products. This brings us to one of the biggest hidden risks for older adults, taking multiple medications at the same time. Doctors sometimes refer to this as polypharmacy. It doesn't necessarily mean the medications are inappropriate. Many people have high blood pressure, diabetes, arthritis, heart disease, or other conditions that each require treatment. The challenge is that as the number of medications increases, so does the possibility of drug interactions and cumulative side effects. Two medicines that are perfectly reasonable on their own may cause unexpected problems when combined. That's why regular medication reviews become increasingly important with age. Now, I'd like to ask you another question because this issue affects millions of families. Do you keep an updated list of every medication, vitamin, and supplement you take? If you do, let us know in the comments by typing yes. If not, perhaps today is the perfect time to start. A simple medication list can help your doctor, pharmacist, and even emergency medical teams quickly understand your treatment plan and identify possible interactions or unnecessary duplication. Earlier, I promised to reveal one of the simplest habits recommended by many specialists who care for older adults. Here it is. At least once a year, schedule a dedicated medication review with your healthcare provider or pharmacist. Bring every prescription medication, every over-the-counter medicine, every vitamin, and every supplement you're taking. Review each one together. Ask whether it's still necessary, whether the dose remains appropriate, whether there are safer alternatives, and whether any combinations deserve closer monitoring. This simple habit can improve medication safety and give you greater confidence in your treatment plan. You may be surprised by how often these reviews lead to meaningful improvements. Sometimes a medication that was helpful years ago is no longer needed. Sometimes a lower dose provides the same benefit with fewer side effects. Other times, a newer medication may be available that better fits your current health needs. The important point is that these decisions should always be made with a qualified healthcare professional who understands your medical history. There are also several healthy lifestyle habits that support brain health alongside appropriate medical care. Regular physical activity improves blood flow to the brain and supports cardiovascular health. A balanced diet rich in fruits, vegetables, whole grains, healthy fats, and quality protein provides nutrients that support overall wellness. Good sleep allows the brain to perform important maintenance functions. Staying socially connected and mentally active through reading, puzzles, learning new skills, or spending time with loved ones may also contribute to healthy cognitive aging. Perhaps the most reassuring message I can leave you with today is this: experiencing occasional forgetfulness does not automatically mean dementia. Many treatable conditions, including medication side effects, dehydration, infections, sleep disorders, vitamin deficiencies, and depression, can affect memory and thinking. That's why new or worsening cognitive symptoms should always be evaluated by a healthcare professional rather than ignored or blamed on aging alone. As you begin paying closer attention to your medications, asking thoughtful questions, and working closely with your healthcare team, you're taking an important step toward protecting not only your memory, but your overall quality of life. Knowledge doesn't replace medical care, but it helps you become an active participant in it. And that partnership between you and your healthcare providers is one of the strongest tools you have for maintaining independence as you grow older. Thank you for spending this time with me today. I hope this conversation has given you greater confidence and encouraged you to take a fresh look at your medications, not with fear, but with curiosity and a commitment to staying informed. If you found this video helpful, please take a moment to like it, subscribe to the channel, and share it with someone you care about. One simple conversation about medication safety could make a meaningful difference in someone's life. Until next time, take good care of yourself, stay engaged in your health, and remember that informed decisions made together with your healthcare team are one of the best ways to support healthy aging and lifelong brain health